Hi, my name is Lacey, and I've been working as a registered nurse for over 9 years and recently began taking on the responsibility of care coordinator. Today, I will be giving a presentation on how to effectively coordinate patient care to help improve outcomes. Care coordination is quickly becoming an intervention that facilities are using to encourage collaboration between healthcare teams and ensure patient-centered care. Part of providing effective care coordination includes ensuring that all providers at various organizations, which are based on each patient's specific needs, are able to be involved so that the patient receives the right type of care at the right time, while also taking their preferences into account and consideration, according to Cautry et al. In 2023. Effective strategies for desired health outcomes. As nursing professionals, we see patients every day with acute and chronic diseases of various severities. Providing education and encouraging the ability for patients to be involved in their care, preferably by self-management to their level of independence, is part of our duty as a nurse. This will vary for each patient, as some might only be able to have a basic understanding of their disease, while others are so independent that they might manage their disease primarily on their own with little intervention. The biggest strategy to encourage self-management is effective communication between the patient and the many healthcare professionals that they interact with. Effective communication is essential because it provides a basis for patients to build rapport that includes trust and loyalty in their team, leading to a better continuity of care, according to Cautry et al. In 2023. The team responsible for the patient is also responsible for maintaining effective communication throughout both their team and any type of specialty providers that have been consulted. Using electronic healthcare records, Cautry et al. In 2023 reports that care coordination can become more integrated, allowing for the team to communicate in a more organized way. One feature of our specific electronic health record system is the function to message a provider while on a patient chart. This allows for healthcare professionals to identify a problem, go on to the patient's chart, and send a message directly to a provider or multiple providers if needed to make them aware of the issue while keeping a trail showing that the issue is identified and then passed on to the appropriate party. By using both effective communication and electronic health records, care coordination can help to encourage patient self-management and compliance with prescribed treatments for their disease, which have both been shown to increase patient desirable outcomes. According to Karam et al. In 2021, effective care coordination involves 3 types of activities, including activities that involve the patient and their family, activities promoting interprofessional collaboration of healthcare providers and social care providers, and activities that bring both the patient and the professional teams together. These authors go on to report that patient education is considered one of the activities that leads to effective care coordination. Depending on the type of disease that the patient is living with, there are many resources available to provide educational materials. Some of these resources include public health classes, self-management programs, and written materials from experts. In the case of heart disease and stroke, which are very prevalent among the nation, the American Heart Association and American Stroke Association have many online and printable patient sheets that can be used for education to supplement in-person teaching, which should be completed by all types of healthcare professionals with each patient. As nurses, we are involved in many aspects of patient care, and we're the primary people that the patients see first when they come into most types of healthcare settings. Oftentimes, nurses see their patients for longer amounts of time as well and have the ability to build those professional relationships easier due to the amount of time spent with the patients. Transitioning the role of care coordination to nursing seems logical, as nurses are educated on providing holistic care, which includes identifying medical issues along with social issues that may be determinants to health, as noted in an article by Karam et al. In 2021. This article goes on to report that nurse-led care coordination and the associated interventions can help increase patient understanding and compliance, improving access to appropriate treatment, reducing healthcare associated costs, and improving communication between the patient and team members. As nurses are able to identify the issues and use care coordination to help address them, a study by Cautry et al. Written in 2023 noted that this continuity that's addressed can help decrease the risk of future hospitalizations and complications. This then leads to higher patient satisfaction with their healthcare team due to their disease taking less of a toll on their personal life. During nursing school, care plans are a huge part of education because they help guide patient care in the hopes to achieve their desired outcomes. Care plans are used to help identify patient-specific needs, interventions, and desired outcomes using both active and passive styles of care. According to an article by Albertson et al. Written in 2022, active style care and referrals, such as helping make patient appointments, is more effective than only providing information to patients. While the ethical issue of autonomy needs to be considered, active care coordination involves considering the patient's specific needs while allowing them their independence and encouraging them to take that step towards getting the proper care that they might not take on their own. This also brings in the concept of beneficence to ensure that nurses are promoting the well-being of the patient while avoiding unintentional harm. The ethical aspect of beneficence in care coordination is referenced in Khatri et al.'s article that was written in 2023 and describes interventions that help promote health and including preventative care, and those can all be addressed in various settings, leading to improved teamwork, safer care, and better patient outcomes. When developing care plans, nurses should ensure that the patient's preferences are taken into consideration and attempt to maintain the highest level of autonomy, which is deemed safe, in order to provide a comprehensive ethical plan of care. How does healthcare policy and patient outcomes impact all of this? Nurses are highly impacted by policies while in the workforce. Healthcare facilities typically have policies to guide their nurses on how to care for several diseases and procedures that ensures that the care the patients receive is based on evidence and what this facility has available for resources. These policies are guided by external factors such as governmental laws and acts that have been put in place to help ensure that all people are provided with a certain standard of care. One of these acts is known as the Affordable Care Act. According to Wood et al., in an article written in 2022, the Affordable Care Act helped to increase access to healthcare insurance coverage overall with the expansion of Medicaid and Medicare coverage. It also provided protection for people with pre-existing conditions and improved access to home-based services. These authors go on to report that this was monumental for the healthcare field as it decreased the amount of uninsured people by approximately 7% in 2015, which is important because when patients are better able to afford care, they are more likely to be seen in the primary care setting, which leads to lower rates of preventable hospitalization and healthcare costs. Again, this was all addressed in Wood et al.'s article in 2022. When nurses care for their patients, the social determinants of health should be considered. If a patient has trouble paying for their care for financial reasons, they are less likely to receive appropriate time and timely care. Working with patients to overcome these barriers is part of the care coordination position and is essential when creating a comprehensive plan. So, how is this essential to nurses? And what is our role? Nurses are essential in healthcare, and with our patients, we see them more often than other healthcare providers. Transitioning the role of care coordination to help nursing provides a more comprehensive care plan, and there's just a certain rapport that's developed during the care between the nurse and the patient. This rapport leads to open, honest communication and increased feelings of trust and loyalty, which helps identify the issues the patients may be afraid to discuss with their other healthcare providers, according to both Khatri et al. In 2023 and Karam et al. In 2021. Once these issues are identified, it is the responsibility of the care coordinator to put a plan in place to address them, and nurses already partially do this when creating care plans and advocating for their patients. Care coordination, especially nurse-led care coordination, increases the safety of patients and decreases the rate of preventable hospitalizations to improve overall patient outcomes, according to Karam et al. In 2021. Please take the time to consider learning more about care coordination and how you can help your patients improve their health and well-being. Thank you.